everybody, to episode number 5 of the Topical Minds podcast. If you are tuning in, please make sure that you support the show by liking, sharing, and subscribing. I have a very interesting topic today that we will be discussing on the show. Our guest today is Marwa Hashimi. She is a certified athletic therapist and personal trainer who is based in Vaughan, Ontario. I'm extremely excited to have her on just because she will be providing us with insights on a lot of the difficulties that we are facing because of either the sort of the current pandemic situation or even just having to do with complications and issues that we experience on a day-to-day basis because of our postures. So welcome, Marwa.
Thank you, Abdullah. Thank you for the opportunity for having me on. Looking forward to our talk today.
Yep. So I wanted to sort of get into what being a certified athletic therapist actually means, and sort of what that encapsulates, and how that is different from some of the other forms of therapy. So there's of course physiotherapy. There's the chiropractor field as well. How does sort of CAT differ from some of the other ones?
Yeah, so athletic therapist, I think, differs mostly in we all differ from our education, I think, is the initial standpoint, but also who and how we treat. So ATs, we're more inclined to treat athletes, which is treating the assessment and the treatment of any musculoskeletal condition. So any injury that occurs with the body, whether that's a physical injury from playing a sport or from even just injuring yourself by going on a walk, or any chronic condition that comes up. We use the sports medicine model to figure out how you're injured, why you're injured, through observation testing, through range of motion testing, and special tests that we put your joints in specific positions to see what provokes your pain and what alleviates your pain. And from that, we come up with a diagnosis of what your condition is, how long you might be injured for, what your prognosis would be, and what a treatment plan would entail for you.
How exactly does that differ from what a physiotherapist would do, though? Would they also follow a similar sort of structure?
Yeah, so all the different practitioners use the same sports medicine model. Athletic therapists, we also have a dual role as working on and off the field. So if you ever watch a soccer game and a player goes down, which happens quite often on the field, and there's a person that runs onto field with a medical kit, that's what an athletic therapist or a trainer in the US is what that is. And they kind of assess an on-field emergency condition as well, whether you make a decision right away if the player is good enough to return back to play and is safe, or if they need to come off the field and do another assessment, or if they need to be sent to the hospital. So we make those on-field decisions as well when we're working with sport teams.
Gotcha. And in terms of like your largest market, like would it be fair to say that university, like undergraduate students, would perhaps be your largest market?
As clientele,
As clientele, yeah.
honestly, it's very variable depending on where you live and what your demographic is. In school, we have the opportunity to work with varsity teams in college sports, just because that's the majority of the budgeting where it goes to. And then you could also have a chance to work with a sports team that's not in a professional setting. There's a lot of ATs that work in professional sport, whether it's at the Olympics or even in the NBA or NFL. But we also work in clinics, just treating everyday people or treating weekend warriors that come in. And then we also work in school settings, either teaching or in a hospital. I think there's a multitude of places that AT can work in.
In terms of the certification process, are there certain organizations that certify you? How does one take the exam, and how long does that process take?
So in Canada, to become a certified AT, you have to attend a school where they offer athletic therapy as a program. So it's a 4-year bachelor's degree. There's 2 schools in Ontario. Sheridan is the college I went to. There's also a program at York, and there's about 7 schools in all of Canada that you can attend. Once you finish your bachelor's degree, you sit for a licensing exam. That's a national certification exam. And then once you write that, you can become an athletic therapist.
Gotcha. I've been wanting to hear about some of the issues that you've been seeing with your patients pre-COVID, or how you would compare the injuries or some of the issues that you saw pre-COVID versus some of the injuries that we are seeing, with COVID.
Yeah, so as we have many patients calling in or even coming in and just having general pain across their body. oh, I work from home. I also take school from home. My kids are at home. Everyone's at home with COVID, and they've just been kind of attached to their computer and their laptops and their desk. And typically, when you're at home, you don't have the best ergonomic setup as you would in the office. Your chair is not as nice. You're sometimes working from your couch or from your bed on your laptop. You're slouched over, as opposed to sitting at a nice office desk where your keyboard is there and everything else is placed properly. So over time, the more you sit and stay inactive, your body ends up slouching forward into certain positions. You're leaning forward towards your computer, onto your laptop, and that causes certain muscles to become tight and spasm, and certain muscles to be lengthened and tensioned, and that causes almost an imbalance in your body where your load and your weight is being put on other joints that haven't been used to it or they're not adapted to serve that purpose, which then causes either joint pain, chronic pain, headaches, all stemming from that. So a lot of the injuries that we've seen post COVID have been from sedentary lifestyles in the past year or so, especially with gyms being closed, especially with trying to stay indoors as much as possible and not being able to step outside for fresh air or for a walk, especially in the wintertime. And if you don't have that space around your house, then it's been very difficult to incorporate an activity into your lifestyle.
When we talk about the like the just general body pain, are there certain parts like of the body where you're starting to see like more of the issues? Perhaps it's the shoulders, perhaps it's the lower back. Just curious to hear.
Yeah, for sure. I think they're it's almost like a 50-50. A lot of patients come in with neck pain from having tension in the back of their neck, and then which causes headaches and creates problems there. The lower back, it's usually done with because we sit in our chairs for so long, our hip flexors, which is at the front of our hips, those become short. Your glutes at the back become inactive because they're not being contracting and being used throughout the day as you walk and walk around or things like that. And then that kind of contributes to lower back pain because it's not stabilizing your joints in the back of your over your pelvis. So that in turn causes low back pain. And then if you go over and try to do something by lifting something up, because those muscles haven't been working for so long, a lot of load gets put onto your back, onto those joints that haven't been used for weight bearing or for loading, and you end up pulling a muscle.
And so I would imagine that the way to prevent that is to stand up and walk around as much as possible, and to stretch and do work those muscles, either be it through lower back exercises with perhaps like weight training, or are there other forms? Like how does one avoid dealing with those issues, be it like neck pain or lower back pain?
Yeah, so it's easy to say to just walk around every hour if you can, right? But I feel like a lot of people get consumed into their work, especially with big deadlines, and especially because you can't walk away from your computer as often. Like your work is at home now, so it's hard for you to leave work and go home and then have a different life, right? Because everything is surrounding that space, that energy there. It's hard for people to step away. What we encourage is there's ways to get out of that, either by having some tips in your phone as a reminder. Every hour, have a little timer that beeps off, and that's your cue to go up, go for a walk, go downstairs, get a snack, get some water, things like that, just to help increase that mobility throughout the day, as well as changing your position as often as you can, things like that. There's also ways that you can encourage activity safely, social distancing. There's been a lot of YouTube videos, fitness professionals that go online and now teach virtually instead of in person. So those are also great ways as well. Have you done anything during COVID?
Yeah, so initially when COVID started and the gym shut down, like I used to go very frequently. I used to go every morning, in fact. And so when the gyms shut down, I was one of those individuals who was pretty heavily impacted just because my routine got disrupted. But then what I started to do is I started to run outdoors a lot more. And it wasn't something that I was practicing before because I would do most of my cardio actually inside of the gym. But then I started running outside a lot more, and that made me realize that certain muscles that perhaps I thought were strong weren't really, just because you have to build strength in different parts of your lower body to be able to handle your weight and so on and so forth. So I started doing cardio. I started working out outside for the most part, working out at parks, calisthenics parks, as well as running. But lower back is something that I have had issues with, just because I used to sort of work out previously. I used to weightlift, and I used to also deadlift. And if you don't necessarily use the right form, then like typically you do end up getting some sort of a lower back problem. But I was able to recover. I was doing my lower back workouts, stretches, and I was able to strengthen that. But during COVID, it's pretty much just been trying to stay as active as possible, work out in some way, shape, or form, like whether it's at a park or whether it's running, and getting at least that cardio workout in. For those individuals who have lower back pain or who have, that neck pain, or they've got sort of shoulder discomfort, how difficult is it really for you to get out of that? We're a year and a half into the pandemic. I myself know several individuals who are dealing with some sort of a body issue, some sort of a body pain issue. How difficult is it for you to turn that around?
It depends on how much time you have and how disciplined you are. You are motivated to decrease your pain, right? You go to a chiropractor or even an AT and be like, I have pain, I would like to get it massaged out. But if you don't, that's the injury part where you want to get figured out. But if you don't do any of your homework outside of that, where you don't do your exercise and do your rehab plan to get those muscles stronger again, it's going to be difficult, and you're going to have a reoccurring injury again, whether if within it's a month or a couple of days or even a year from now. With lower back pain specifically, a lot of it's a lot has to do with the core exercises. So your spine is pretty much muscles surround your spine, the core muscles, and it surrounds it like a corset. So it activates from all around. It's from like a 360 type of support. So we train a lot of the deep core, where you have to kind of work to stabilize the spine, and it's more than just doing sit-ups or planks. Planks are a really good exercise for core, but you have to kind of create that stability before you can even go ahead and to do more advanced exercise, if you know what I mean. So we'll get you started off just doing some pelvic tilts, which is just kind of bracing and hollowing, bracing and hollowing. And then that gets implemented into any type of exercise, whether you're squatting, running, deadlifting, even doing a shoulder press. You would use that same exercise, and it'll be more involuntary, where you don't have to think about it.
Gotcha. It's interesting because having looked up core workouts for I can't imagine how long. It's interesting, but I've never come across like stabilizing your core first. So like the pre-workout to actually doing sit-ups and planks.
Yeah.
And is that something that you have to do alongside an AT? Is that something that you can just do at home? Like, how does one figure out what exactly that sort of exercise looks like?
There's a lot of information online already. If any fitness person, kinesiologist even, can know about it too. But if you're looking for core exercise, I would say like Googling core exercises with physio or something like that. And that'll give you a range of dead bugs. It'll give you a range of leg lifts. And that's more of the foundational core exercises. Once you get good at those, once those become easy, then you could advance into your sit-ups, into your Russian twist, anything calisthenic as well can be also be involved in that too. So it's just about, the internet is really, really great at finding information. You just have to kind of know what you're looking for or searching for the right things, instead of just getting a six-pack ab workout on from the Google.
Right, that makes total
Yeah.
sense. During COVID, you mentioned you're starting to see a lot of patients come in with just general body pain. Is there anything that's stood out to you in terms of the types of problems that people were coming in with prior to COVID versus during COVID? Were there certain issues where you're like, yep, that's definitely like COVID related because of either working from home or whatever that reason may be?
I think generally all these problems have existed before. What I would say now, from pre-COVID to post or even current right now, it's a lot has to do with the stress and the mental aspect of it as well. So once the body or the person has like a mental health issue or trauma, we find that injuries are takes much longer to heal because you're highly stressed, because you don't have your anxiety because of the current state of the world of the pandemic. You don't have access to your same social network I was before. A lot of things get heightened in this duration. So you might feel neck pain way more than it was before. Your headaches last 3 days instead of just a couple of hours. Things like that have really been pronounced post COVID as well.
That's fascinating. And how do you diagnose that, or how do you treat that? Is that something that falls under like the athletic therapist's diagnosis and solutioning, or does that get referred to somebody else?
It would depend on the severity. If it's a critical like mental health issue, where we have to refer out to a specialized specialist who can deal with that, whether it's psychotherapy or any type of therapy like that. We don't diagnose any mental health issues, but if we suspect any like yellow flags, it's kind of related to socio-psychological factors. A lot has to do with about the education. A lot of people, because everything has been so unknown the past year and a half, a lot of people have this stress of my injury, my back pain. I don't know what's going to happen. I don't know how I'm going to feel. I don't know when I'm going to get better. So we have to really increase our education and our communication with the patient, letting them know you feel like this because this happened. And this will take this long. If you do this exercise, it's going to help you because why? Your anatomy is based off of this. So once we get that communication, people have a really great understanding of what's occurring to their body. It also brings down that anxiety factor, which then can help their recovery too.
And what about the diet and sleep component? Is that something that gets addressed as well in these, when patients come to you, or is it more of like a holistic solution that's provided to clients?
Yeah, although we're not specialists in sleep hygiene or diet per se, we do have an understanding of how nutrition works and how sleep works. Sleep, because depending on how you sleep, you can be in one position all night if you don't move at all, or you can be moving around all night, and that can affect how your body reacts to it. We spend at least 8 hours a day sleeping for every day of our lives, so that of course has an impact on how your body is functioning and how your muscles react when you wake up in the morning too. So we always ask, especially if it's a back pain patient, how do you sleep? Do you sleep on your side, your back, your stomach? And that kind of implies how they would react when they would wake up as well.
You're not supposed to sleep on your back as well as on your chest, right? Like ideally you should be sleeping on either side and not even on the left side, because your heart could potentially feel pressure. Is that correct?
That's more if you have like a chronic issue with circulation, things like that. Generally, if you're a healthy person, you can sleep any position. What you do want to avoid is sleeping on your stomach, because that puts your lower spine into a little bit of extension, which then can cause some back pain later on. Also, if you sleep on your stomach, you have to turn your head one way or the other way because you don't sleep face down like this. So that can imply some shortening or implications in your neck too.
So would it be fair to say then, so you're not supposed to sleep on your stomach because of course like you're hyper extending your spine. Is the ideal position to sleep on your side?
It depends. We say that all the time. It depends, it depends, it depends. But if you sleep on your side, it's very comfortable if you have a pillow in between your knees. So your knees are being supported and not crash or compressing down, and then your low back is supported. It also depends on your pillow type too. If you like a side sleeper, you can have like a little bit of supportive pillow so your neck isn't like this, like compressing down into your shoulder, and you're more elevated, so you have that space as well.
Right. You mentioned referring patients depending on their if you see certain yellow flags, and that requires a diagnosis. You would refer them to sort of the right individuals. Do you see other practitioners in other fields referring their patients to athletic therapists? Has that increased in the recent past?
We mostly see doctors referring. So the primary healthcare provider for anybody is usually their family doctor. They would go to them first, usually for any type of like joint pain, anything like that, and the doctor would write a script. You should see an athletic therapist or see a physiotherapist for rehab purposes and for treatment to get that soft tissue work, to get the muscle release, things like that. So most of our referrals do come from doctors. But again, we all, depending on who you know and who's in your professional network, you can refer out to anybody else, and same for to get referrals.
Gotcha. When it comes to sports related injuries, of course, with the whole lockdown situation, individuals weren't necessarily playing soccer or basketball or weren't necessarily playing sports anymore. And then with things reopening, of course, people got back into the whole sports sports space. And you had mentioned that has created several different types of injuries and problems that we weren't necessarily seeing previously. Can we speak a little bit about that? Like, what's that been like for you, and what type of injuries have you sort of seen?
Yeah, of course. So I work with a soccer team, a provincial level soccer team as well, that I've done a little bit of training with in the past. And we found that some of the girls who haven't been training since the COVID period has started, since lockdown was occurring, they weren't performing to the same capacity that they were before. Obviously, not training every day, not conditioning every day, so that brings their performance level down. When you go back into a sport, you're expected to go right in. Sometimes there's no kind of training period. You go right into play your sport, same level as before. And when your body's not used to playing at that certain level, injuries can happen. So we've seen a number of ACLs occur this past summer, just when sports reopened. It's been traumatic just because it takes surgery. It takes about a year to full recover before you can even go back to play or back to your sport, just because of the high risk of injury. And it's a really rigorous rehab process. It's very painful, and it requires a lot of motivation and a lot of discipline on your part to rehab yourself. So that's what we've seen mostly. And what I suggest to general public: if you play a sport, don't go back into it at full speed without a warm up, without any type of conditioning or training beforehand. Same with running. If you're ever interested in going back into like running after taking some time off, you really have to work yourself towards it instead of running for that marathon right away, right? Your body takes time to adapt and get used to it again.
And for those who don't know what an ACL is, that's essentially a knee injury, right? Can you explain what exactly happens there?
Yeah, so the ACL is a small ligament deep within the knee. It's paired with a couple of other ligaments as well, but it sits in the knee ligament in the knee joint like this. So it crosses over at the front, and it's important for twisting and turning. So every time you twist one way in sport, or even turning around, twisting on that knee, it becomes torsioned. So with sports, a lot of the injuries happen by accident, of course, right? No one's intending to hurt anybody. But and one of the accidents that happen is if your foot plants and then your body turns around it, then you can tear your ACL, just because that quick torsion causes that ligament to tear or partially tear.
If you were to, if you were thinking of getting back into sport, the way to strengthen it would just be to do light exercises and stretch. How does one strengthen the ACL?
So because the knee is surrounded, it's around the knees typically isn't surrounded by muscles, but it's supported by your big quadriceps at the top, your hamstrings at the back, and then your glutes as well. We focus a lot on strengthening the big supportive muscles, and that'll help preventing your knee from turning into a full torsion. It'll likely help it by keeping it more stable and supports the knee joint. So definitely strengthening those muscles in specific to your sport. So if you're doing agility training, it's training, or if you're playing football, you want to start some agility training. So you would do some training cutting back and forth, making sure that you're able to turn and on a quick note and run for the ball, accelerate and decelerate.
Right. So you're doing a lot of. I would imagine you're also doing a lot of explosive exercises to develop that, the ability to sort of like take off and explode, and that is connected to functional mobility, right? Functional training as well. Are those sort of connected?
Yeah, so you can either call it sports specific training or functional mobility or functional training. And that just pretty much means that you're training for your activity that you're doing. Whether you're a gardener who always has to bend down, pick things up, you want to practice in the gym, bending down, picking things up. So you're strengthening those muscles that you use in your activity. If you're a soccer player, you want to strengthen the leg muscles to help support you as you're running it up and down the field and also getting the ball and dribbling like that.
And when it comes to a lot of the conventional exercises, there's two different schools of thought. There's the one school of thought where, like, if you do, for example, the bench press, you've got one school of thought where they're like, that's not really a functional movement because you don't actually end up doing that movement in everyday life.
Yeah.
And so the preference is more to focus on those functional exercises where you can really uh, benefit from just on an everyday basis. And then you've got the other school of thought where the idea is to build that muscle, and then once you've got that muscle, that it can be leveraged to do perhaps functional movements, if need be.
Mhm.
And you can utilize those muscles. Like, where do the athletic therapists, is there a preference that athletic therapists perhaps give to functional training over some other forms of training?
Yeah, of course. So a lot of athletic therapists can get a dual, another certification, which becomes a strength and conditioning coach. And a lot of ATs kind of have that dual role, especially if you're working with a sports team. Whereas a strength and conditioning specialist really knows the body and how it reacts in a sport. So when you're talking about the bench press, yes, the bench press isn't very functional in a lot of sports, but it can be very functional in football, especially if you're an offensive linesman who needs to be pushing against other players, right? So you need that power and support to come from your arms and your upper body to push against other players. So that's where a bench press would be used in your training routine, especially if you're in your off season where you need to be conditioning for your sport to get better and improve for the next season. If you're a regular gym goer who doesn't really train for any like specific type of activity, bench press is also great because it builds upper body strength, it builds up your chest, it builds up your posture. So it can be used as like a functional exercise as well as a conventional aesthetic exercises, as long as you're kind of moving and working out and keeping healthy too. Why not?
Yeah, and is it important, because you had mentioned that you are a personal trainer as well? Like, is it important for somebody who is a personal trainer? Would you recommend them also perhaps, getting a certification in athletic training just because you have a better sense of, how injuries could perhaps occur and ways to sort of diagnose those and resolve those? Is that something that you would recommend and encourage people to sort of bring into their toolbox?
Yeah, it depends what their clientele is. If they are working with individuals who have issues with their body. So for myself, a lot of my personal training clients are actually old patients of mine who've had back injuries, who've had knee injuries, or haven't been ever to the gym, but they want to learn how to use their body. I kind of educate on form and technique and how they can lift safely for them to work out in an environment. But if you're a personal trainer who just likes the fitness aspect and just working out and moving your body and things like that, then you can always refer your patients out to an athletic therapist or to a physiotherapist to kind of help them in their goals. You don't have to be that person that does everything for your patient. It's good to kind of know your role and how best you can help someone, but then also refer out if you don't know anything else.
In terms of injury recovery, are you familiar with cryotherapy?
So they're called therapeutic modalities. So they're extra things that you can add on as part of your treatment or your therapy to help kind of increase their recovery. In the sports setting, in a college setting, cryotherapy was heavily used, where the team would come in from the practice from the gym, and there would be ice baths sitting in the corner of the clinic, and they would jump right in, being in a cold tub to get that cold contrast therapy. So it would be cold in one tub and then hot in the other tub. And then they would go back in and out of both for about 10-15 minutes. And that helps to really aid in muscle recovery, especially if they had a 3-hour practice for 3 to 4 times a week. Some of the greatest athletes, Kobe Bryant, LeBron James, they've also really advocated that keeping on top of that icing after their games and practices have really helped them in their recovery process, as well as keep up their performance in a long season too. So we've heavily used that as well. In terms of injuries, you can use it to decrease inflammation and decrease pain. Yeah. Have you had an experience working with cryotherapy?
No, I haven't, but I've heard of several athletes using it, and there's many different types. There's the ones where you sort of like walk in, but your head sticks out, so the rest of your body gets the therapy, but your head. And then you've got ones where it's sort of the entire body, and then you've got the ice baths, which a lot of athletes use as well to help them with their recovery, especially if you're working out 2 to 3 times a day,
Yes.
which in certain sports. Athletes do have to do. But I haven't tried it. Cryotherapy is something that I have wanted to try, but the I have taken like ice cold showers after workouts, and just there's numerous benefits. There's studies that show that taking an ice cold shower or a bath after your workout, as you mentioned, it helps with recovery. But there's also, I think, some studies that show, and I hope I'm not wrong here, but I think there are some studies that show that it actually has an impact, positive impact on the production of human growth hormone. So it actually keeps that up after a workout.
Okay.
Yeah.
Good to know as well. But yeah, there's lots of tools now. I think um, functional training and fitness and the whole fitness aspect, fitness world has really expanded over the last couple of years. There's been a lot of new modalities that have come out, especially with the. Have you ever tried the Theraguns or the massagers? So
No.
those are pretty much a battery operated gun, and it's percussion, so it vibrates at one end, and then you could use that to kind of massage out your own muscles. Things like that at home can really help with any type of ache or pain that you might have too.
Yeah, I actually, now that you mention it, I was over at a friend's place not too long ago, and he showed me, he's got one of those guns.
Mhm.
And it's something that you use to massage, right? Like your body, like that's basically what it is. It's like a massager, like a handheld massager.
Yes.
How effective are those?
So they're effective in the short term. The studies that that I've read say that yes, it helps kind of decrease that muscle spasm and that tightness that you feel after in your muscles after a workout or even just from general pain, but it's not very long lasting. For you to be able to feel it over time, you have to be doing it for like a lot of minutes. So it's going to be an extended, prolonged time for you to really feel the effects. But for short term, it does decrease a little bit of the muscle spasm and it creates almost like a softness in your muscle, so it's not so rigid. So it does help for that, but for long term effects, there's not many benefits from it from the studies that I've read.
Honestly, when I used it, I thought as though perhaps like if you used it incorrectly, or if you weren't necessarily aware of how to use it, you could potentially actually end up injuring yourself. Just because I felt as though the force
Yeah.
at the end like was quite significant, and I was like, if you end up using this like on your neck and you don't know how to use it correctly, like you could potentially do quite a bit of damage. That's what I remember like thinking at the time, and I think I might have even just mentioned it. I would imagine that you would have to at least be somewhat informed on how to use that, right? Like I feel as though those could potentially be a little bit dangerous if you didn't know how to use them.
Yeah, especially if you're kind of offering it to your friends with people who don't really know, or if you're doing it on somebody else as well, right? You could really hurt them if you don't know your pressure. Generally, for those, the main rule of thumb is to not go over any bony prominences. So anything that's bone stick out, if the back of your neck, on your shoulder blades, those type of bones that are really at the surface and superficial, try not to go over those because that causes a little bit of pain. They are meant to go only over muscles. Don't go anything over the abdomen where your organs are, anything over the chest where there's lots of bones and sensitive areas like that too.
Gotcha. Yeah, that's good to know. Um, are these guns tools that you use in athletic therapy?
Yeah, we have them at the clinic. So there we use a more of a therapeutic model or brand. It's called Thumper, but Theragun and hypervolt are kind of marketed as like for the everyday people, so they can be found online and they can be bought by anyone.
In addition to these guns, are there additional, perhaps new ways of recovery that you're seeing being used more and more often by athletes, or that are perhaps just being tested to see if they're even viable?
Another one that I've seen was it's called the Normatec is the main brand that comes out with it, and it's compression leg sleeves.
Okay.
So they're pretty much it's like snow pants that you put on all the way, and they're attached to a little motor, and you turn on the motor, and then the sleeves blow up, causing compression into your legs. Have you ever been to the mall and you see those chairs in the middle of the mall? You can sit them and they kind of squeeze your legs and things like that. It feels like that, but on your whole entire leg, and it's a lot more graduated pressure. So it can go through cycles of compressing and releasing, which gives you a pumping effect, which can decrease joint swelling. It can massage out your muscles, things like that. And it feels really, really good. I think a lot of athletes use that as well, especially basketball athletes have been using it after practices and games to help recover for their next game, which is the next day or something like that.
And what's happening there? Is it just an increase in blood flow that's reducing inflammation essentially? Is that what's going on there, or?
Yes. So when you constrict blood flow, it tightens up the blood vessels. And then when you bring blood flow back, it dilates the vessels. And that kind of creates a pumping effect in your body, in your legs, to increase circulation and decrease circulation. So that's going to help bring, with increased circulation, brings nutrients, brings oxygen to the area, which help decrease inflammation and removes any waste or byproducts that are formulated in your cells in your blood.
Gotcha. And I'm wondering if that has any impact whatsoever on your heart, just because it's not regular blood flow across the body. Blood flow is being induced, and so I'm wondering if that has any sort of impact on your heart being able to handle that irregularity, I guess, in blood flow that's being caused by
I
the
see.
compression.
It doesn't constrict all the way. There is some blood flow that still goes, so it's not like you're cutting off constriction. Generally, it's completely safe to be used unless you have like any circulatory problems, any like varicose veins, any like loss of sensation, or if you have heart and blood pressure issues, then I would shy away from using that on somebody who would want to, and just have them confirm with their doctor or something like that first.
As a personal trainer, I wanted to get your thoughts on stretching. Again, it seems as though there's a few different schools of thought here. There is the school of thought that that says that you're supposed to stretch prior to workout. There's the school of thought that says you're supposed to stretch after a workout, and then there's this school of thought that says that you actually shouldn't be stretching. I've seen some of those videos on YouTube as well, where the recommendation is you shouldn't be stretching for a few different reasons, but I wanted to get your take on it. Where do you stand on stretching, and is it something that is important for you to do? Whether you're weight training, whether you are, doing, for example, cardio training, whatever that type of training is. How important is stretching, if at all?
Absolutely. I think it varies. I keep saying depending a lot, but I think it matters on what type of stretching you're doing before and after your workout. Before a workout, you want to increase your mobility, increase your heart rate, and increase range of motion in your joints. So you don't want to do stretches where you're kind of just holding it, right? Where those are called static stretches, where you hold a stretch for a number of seconds and then you let go and then you hold it again, or another stretch. In the beginning of a workout, you really want to get used to the movement. So you would do dynamic stretches where it's more of like a flow, where you're going through the ranges of motion that are required in your workout. Say if you're squatting, you want to get some knee bends in, you want to get some hip flexion in. So bending down, picking things up, even if it's unloaded, just doing a body weight. And that can be a part of your warm-up routine, instead of just running on the treadmill for a cardio warm-up. You want to kind of increase your heart rate, but also increase the movement within your joints. And that's going to help protect you when you're going out and doing your squats and doing your deadlifts. After your workout, you can do your static stretches, and that helps cool down your body. It also helps elongate and stretch out the tissue and then bring it back. So it it reduces your soreness, and it also won't cause you too much pain afterwards too. You won't get the delayed onset muscle soreness as much.
So the stretches prior to working out, those are more dynamic as opposed to static, and the ones post workout, are those more static as opposed to dynamic? Is that
Yeah, that's right. You can also end off your workout with another dynamic, like low recovery kind of routine to help still move your body, but also bring down your heart rate. And that will help too. You don't want to do another point. You don't want to do static stretches before your workout, because it actually decreases your performance and it decreases your power output if you're wanting to do any sport or explosive activity. So research has shown that the longer you hold a stretch, that the muscle fibers won't fire as rapidly to get you that explosive power. So you want to do more movement stretches to help contract and relax instead of just relaxing.
got it? That's interesting. So definitely don't do any static stretches before you're working out.
Yes.
Stick to the dynamic ones. And you don't necessarily even have to do cardio. You can get your heart rate up just doing dynamic stretches. Essentially, that's what the takeaway is.
Yeah.
That's interesting because I definitely didn't know that. I was just under the impression that if you stretch, I'm familiar with static and dynamic stretches, but I wasn't aware that you're supposed to do one over the other
Mhm.
pre-workout. So that's something that's interesting. And then you basically cool down at the end. You do but aren't static stretches just bad to do then to begin with? Because you're ultimately, even if you're cooling down, would you still want that range of motion? Wouldn't you still want that, or is that still not important when you're cooling down? The idea is to basically do the static stretches to get your muscles relaxed.
Yeah, so you do the static stretches to get your muscles relaxed and then also elongate them. So, say for your neck, if you want to stretch out your neck, you're going to bring your ear to shoulder to one side, and that helps kind of stretch out that muscle so it doesn't stay tightened up overnight when you go to sleep. So, I don't think it's a bad idea to do static stretches. It just depends on the time and the place and your reason for it.
I wanted to come back to some of the issues that we are starting to see as individuals are going back into playing sports. You mentioned ACLs. That's an important one. Aside from that, are there any other injuries that you are seeing? And what advice would you have for individuals aside from perhaps warming up to stay away from those injuries?
Yeah, so I think from a like a professional standpoint, we've seen like in the NBA in the past season, we've seen a lot of the players go down with pretty traumatic injuries, whether it was like a really bad strain that never got better, or something like an ACL, or even with some of the ankle injuries that have occurred. Things like that can be prevented if you start with a good training load. So if you have a competition or a game at the end of the month, you want to take some time every week to kind of train slowly and build yourself up to that game level, whether it's working with a strength coach or with a fitness professional or somebody else that knows about the field. Um, Kind of increasing your load every day. We call this progressive overload in our industry. It's pretty much getting your body will adapt to anything that you impose load onto. So if you're starting with 5 pounds of squatting today, then you could do 10 pounds tomorrow, and then by the end of the week you can maybe get to 20 pounds. But it's trying to build that gradual progression instead of going from 5 to 20 right away, because that will cause your tissue to fail, which can cause injury.
Progressive overload is interesting because there's progressive overload and then there's shocking, right? That's shocking your muscles. I would imagine shocking and progressive overload are probably, if not at the opposite ends of the spectrum, but perhaps like pretty far spread out, right?
Far spread out, yes.
Okay, and it's research has shown both to be beneficial in terms of gains if you are trying to depending of course on the type of training that you're doing, but if you're doing weight training, then research has shown both shocking your muscles as well as progressive overload to be beneficial. Do you recommend using a bit of both? That's question number one. And then coming back to progressive overload, I'm pretty interested in this. So how does one know to move up in, and let's just take the case of like weight training, like how does one know when exactly to move up in weight? Like I've basically come across certain studies where they say, like, ideally, like if you are able to do 12 reps
Mhm.
with a certain weight, then that's generally an indication that you can go higher, and then you could go higher up in weight. Like, is there a threshold when it comes to when you exceed it, that you can move up to the next weight? How does one know when to progressively overload?
Yeah. So I'll answer that question first. You can use a rating scale. So on a scale of 1 to 10, how hard is an exercise? So at the beginning, if you're squatting, so let's say 10 pounds and it's 10 out of 10, 10 being very hard, it's hard for you to finish that last rep, right? And you feel like you can't, there's no more energy in the tank to pull up another rep. Then that's your maximum for that day. The next day, as you get better and stronger, your muscles adapt and now they're firing more effectively. You have more control and more neural drive to that. You're able to do more. So then you would base it off of your 1 to 10 scale. If you're doing 10 reps and by rep number 8, you still feel like you can do a couple more easily, then you could put up your weight
Gotcha.
on your next set, and that will increase your intensity of the exercise. If you don't want to put up your weight, saying by like 5 pounds, you can also increase your reps. Instead of doing 10 reps, you'll do 12 reps, and that also increase your intensity too. So it's playing around with those numbers, whether it's your load or your reps, to increase your intensity, and then that will progressively overload your body and your system. Does that
Got
make
it.
sense?
Yeah,
Yeah.
that makes sense. So, and how often should I would imagine you probably hit a peak at some point, right? Like you won't be able to overload beyond a certain limit. Is that fair to say?
Yeah, your body will adapt to how much it can handle. I read a really interesting book a couple of years ago by David Goggins called "Can't Hurt Me." If you've heard of that, and he
I'm
really,
familiar with David Goggins. Yeah, he's quite. I would say he's quite the outlier. Like what he's able to accomplish, it's very few people are able to accomplish.
very
But
people, but it's very it's a I like his discipline and where he comes from, where he says that the average person only uses about 40% of their brain, and there's so much more you can potentially accomplish if you lose more. So it's about pushing yourself too in that aspect and trying to see how far you can go. Sometimes it's very mental that, oh, I can't push up one more rep, but if you can, then you can. And you see those experiences occur across like the Guinness World Book of Records and anybody else on social media who kind of goes viral for a week, like a little girl being able to push how much weight, right? So things like that are possible, um, as long as you're safe with it, right? It depends.
yeah, I've been. You see his posts on Instagram, and you know that he is not. I mean, he's an athletic. I wouldn't say freak, but he's definitely an outlier.
Yeah.
Safe to say, like the things that he's been able to accomplish, and his mental his mental strength and his willpower are, I would say, probably second to none. But there's very few David Goggins on the planet. Like there's him, there's Cameron Haynes, there's some of those individuals up at the top of the food chain. So the second one, coming back to the shocking versus the progressive overload. What are your thoughts on those?
So I think with shocking, I don't know too much about it. I haven't studied too much about it, but I believe it's talking about the neural drive to shock the system and to increase kind of potentiation, to increase muscle energy and muscle contraction. So in that sense, um, yes, you want to be able to shock the muscle to kind of increase that energy in the muscle, but at the same time you want to be sure that the muscles are firing correctly. So when you were working with certain types of muscle groups, sometimes one muscle group will turn on before the other one just because it's always used to. I'm going to use the example of a lower back injury. When you have a lower back injury, because the lower back muscles called your erectors that run along your spine are so much in use because it's using that you've been using that to bend and extend and move and do everything. Your glutes are technically turned off and they don't really contract when you're doing activity. So a lot of load goes through the low back now, and not a lot of load goes through the glute muscles. And if you look at the size difference between those two muscles, the glutes are very much bigger than the erectors, and they can't handle a lot of energy. They get fatigued easily. They can't handle that load, while the glutes can. So when you're talking about the neural drive, it's more kind of creating that big contraction in the muscles that you need to fire instead of the muscles that you don't want to fire. And I think that's where that kind of terminology comes from.
Yeah, I was under the impression that it meant, and this is like a very simple example, but like let's assume you were doing, let's just take the case of like doing a bench press. If you were for weeks just doing flat bench press, and then like, the next week you decided to either do decline or incline, that would technically be considered shocking your muscles because you're working a separate part of your muscle. I think that's what that refers to, but I could be wrong. Perhaps it's what you're referring to. I did want to ask you about, just because the point you mentioned just made me think about something else. Are there certain exercises that you absolutely recommend one should be doing, when you go to the gym? Perhaps it's squatting. Perhaps it's working on your glutes and your hamstrings. Are there certain exercises that you feel perhaps we often overlook when we walk into the gym, and that you would recommend us focusing on?
Yeah, definitely. I think squats are really great. I like personally, I always give my clients total body exercises instead of just focusing on one area, because it will work out. That's where the functional aspect comes from. Squatting is very functional. You use that every day to sit down, get up, pick something up, pretty much every day, right? But in terms of knowing how to squat and using the correct muscles properly when you're squatting and feeling the correct muscles is very variable, for different people. Some people think squats, they just feel it in their quads. Some people feel it in their back when they shouldn't at all. And then some people feel it in their glutes where they should be. So if if that's the case, then I always suggest like do some foundational exercise to activate the glutes to help with your squat. So then you do feel it in the glutes too. So that includes your isolated exercise, which are bridges, which are clamshells, which are leg raises to kind of activate all three of the glutes instead of just one part of it. And then that'll help you transition into a more powerful squat and be able to increase your load and your reps too.
Yeah, that makes total sense. When it comes to a total body workout, are you doing those on are you doing like a full body workout on a day, or do you spread that out over multiple days? So for example, like, are you doing like, legs on one day, and then you do, perhaps back on another day, and then you focus on arms the next, or do you do exercises for the entire body on a particular day, on the same day?
I tend to do full body workouts. I like activating everything in one go and just getting a nice total body workout and sweat. But in the past, I would do it my splits where I would do legs and then upper body and then lower body again, or then core the other day. It just matters on how much time you have and how much availability you have. With work, sometimes it's hard to kind of schedule those in. And then if you miss legs one day, then it's hard to kind of pick that up again. So I find total body kind of gets the whole picture, everything done too.
And then what does that mean for recovery? Because I was under the impression that, like, if you're doing, legs, let's say on Monday, then Tuesday you want to give your lower body a rest and perhaps do something else. So if you're doing a full body workout every day, like, are you taking, is the suggestion to take rest days in between? And on those rest days, perhaps you do, active recovery, or you do something else. Perhaps you do core. Like, how does one go about that?
So if you're doing total body every day, you can also break up on how much emphasis you're doing on lower body versus upper body. So in a say you have about an hour of your time to do workouts every day, if you do half of that lower body every day, then you won't be as sore as you would as if you did a whole day of a whole hour of legs. Do you know what I mean? Just because you're
Right.
not putting the same type of intensity and load and time into it. So that's why it kind of, you have to listen to your body. If you know that you're going to be sore doing legs that day, maybe don't do the same amount of squats that day, maybe do a little bit less, or try a different type of squat, whether it's a front squat, a goblet squat. There's so many variations of everything where you can still work out every day, but you can incorporate different types of movements.
You could technically do, quads one day, you could do glutes the other, like, depending on what your exercises are. So you could potentially be doing a full body workout, but just hitting different muscles,
Yes,
right?
exactly.
Like, you could do incline one day, flat the next, and so on and so forth.
Exactly.
I wonder if that's been shown to be more beneficial versus like just having, a chest day and just having a back day. I think that's something perhaps that I would want to look into. Do you have any information on that at all?
I've read some articles. I feel like a lot of the fitness the fitness information has been based around men, and like men is the main subject in these articles and the journals. I would like to see how it affects females more, because our bodies are they adapt differently, they develop differently, our hormones and everything kind of change and cause that to cause different reactions. So it'd be interesting to see that as well. I know there has been studies and showing in athletes as well, so it'd be interesting to see the different loads that somebody takes and how that can affect their body.
Yeah. Yeah, that's something that's interesting for me, because I actually am in the do like a specific. I don't do full body workouts. I do like specific. I do splits.
Yeah.
So I'm interested to know like which one's more effective, because I do I do see the benefit in activating all your muscles, um, and like doing that more frequently, because I completely like what you said earlier like resonated with me. Like if you miss legs day, right, and like if you're not able to sort of like if you miss that day for whatever reason, be it work, then like it's hard to sort of like make those up, and you sort of like the rest of your routine gets thrown off a little bit. So I'm interested to see if perhaps it's beneficial to do like full body workouts but just do different exercises. That's interesting. I did want to get from you just any sort of thoughts and suggestions that you may have for all of those individuals who are still working from home.
Mhm.
Any tips, any suggestions? You know, we spoke briefly earlier about it being difficult to take those breaks and being able to, you know, walk around and, you know, get away from your workspace. But if there's any sort of suggestions that you may have to make things better, you mentioned having that timer that goes off every hour. That's sort of like a heads up for you to you know to walk around and take a bit of break. But um, you know, how can individuals stay injury free? And you know, are there certain perhaps exercises that individuals can do at home if they're not currently going to the gym or working out outside? Are there certain things that individuals can do at home to stay more fit?
Absolutely. I think the biggest thing about working from home and trying to encourage activity into your lifestyle is breaking the habits that you're currently in. So, if you've been so used to staying at home and only doing one thing for so long, how do you change that? And how do you kind of change your routine when you're so used to one thing and it's been working well for you, right? Or maybe it hasn't, but you don't really know that it's occurring or causing an issue. I like using that timer example because that really kind of it's in your face. It's an alarm that sets off, and you're like, that's your motivation to kind of get up, and that's your cue to do something else for even if it's only 5 minutes out of the day. Other kind of funny cues that we use is drink more water, have more water at your desk, and then you're able to go to the bathroom more, and that's a way of kind of getting up and walking away. And then slowly these habits can become a break in your cycle, and how you can really work towards using your everyday life and using using our tools that we have to help create those positions. One thing that I do when I drive is I kind of tend to slouch over, especially if it's a long drive. So I put my rear view mirror a little bit elevated, so I have to sit up higher to go look at it, and then I'm sitting up a little bit straighter instead of slouched.
That's smart.
So little tips like that can really help, and even if it's a small thing like that, it can really attribute to something, especially if you do it every single day.
Yeah, no, that makes total sense. Speaking of which, I have a long drive tomorrow, and I may just bring that into the. I may just incorporate that just to keep my posture a little bit better. I think we covered quite a bit of important stuff. We've all sort of encountered some sort of an issue, be it body pain, be it some sort of discomfort. So I'm sure the suggestions and the advice that you've provided will be helpful. Is there anything that you would like to promote, perhaps like shed light on that we haven't spoken about?
Yeah, I'd like to say that if you have any kind of recurring injury, whether you're a gym goer, whether used to be or used to be really fit when you were younger and want to get active again, try coming out for a session. It can help. You can help learn something about yourself and how your body moves, and you can maybe figure out a new way on how you can get active again and get healthy again. So as athletic therapists, we always try to promote an optimal healthy lifestyle, whether your goal is to play with your kids more or go out and play soccer on the field again outside. It all depends on what you want to do, and we can help towards that too. So if you're ever in need, reach out to someone that you know, or you can look somebody up on Google, and someone will be in the area to help kind of get you better onto a better lifestyle.
And how can somebody find your clinic? Just go online. Is there, how does one book slots as well? Do they just go online? Is there an app, or do they call in?
They can call into the clinic. Our clinic is called Iconic Health and Wellness. We're located in Vaughan, at Weston and Highway 7. We also have an online website or online booking site where you can see the availabilities of who is in that day, and you could book accordingly through there.
Awesome. Yeah, I can imagine. Has it been busier since things have reopened? Have you started to see more patients come in?
Especially after the first closure, where in March, from March 2020 until June 2020, where everything was shut down and nothing was open. Since then, we've seen a big increase of patients coming in just because they haven't been able to do something for so long, and they really miss that aspect of coming into their therapy and getting active. And then people with the chronic issues weren't able to get in to get their usual regular appointments. Other than that, it's been great seeing people coming out again and being able to take care of their bodies, even if they've had an injury from years ago. And now they kind of realize this is the time for me to kind of focus on my health. I think that's what the pandemic has really brought out into light, how much we can be aware of our bodies and of our health and our healthy mindset. So we can use any type of tools out there to help increase that too, to get on a better path.
Yeah, I mean, I know several individuals, at least three, at the top of my head, that I know have dealt with issues specifically due to the pandemic.
Mhm.
In fact, one of my friends was telling me that he's just because he's been sedentary, and that he spent so much time at home, that his heart rate goes up fairly high and fairly quickly, like if he just walks around the block. And he's quite young too, so it's a lot of individuals are experiencing issues. And as you mentioned earlier, and I think this is an important point, is that as your mental health gets impacted, as you are dealing with more stress from all these factors, that a lot of these problems that you have actually get exaggerated. It's because there's increased inflammation in the system, and that causes a whole bunch of other problems. So I think I'm sure you'll continue to see like a flood of clients, of patients coming in to get your services. I wanted to thank you for your time. It was a pleasure speaking with you. And even for myself, just being, trying to stay active, I got a lot of really good information for myself. So thank you for being on the show. And for all of those who tuned in, thank you very much. Again, this was episode number 5, and we're going to keep this going. If you liked the show, you can find us on YouTube, Spotify, Apple, and Google Podcasts. And I look forward to seeing you on the next one.